So, good day everyone. My name is Maria Vea Bianca Alvaray, and I will be discussing the topic of Chapter 7, the stages of labor. First stage of labor. So, thinning of the cervix, or this called as effacement, while the opening of the cervix, this called as dilation. During the stage of labor, contraction help the woman's cervix to thin and begin to open. So, this is called, among ganit lang nakagaina, effacement and dilation. So, as the cervix dilates, the healthcare providers will measure the opening in centimeter. So, sukdo nila na in centimeter. So, during the stage, the cervix will widen to about 10 centimeter. So, the first stage of labor usually lasts if first baby maglast ni siya about 12 to 13 hours. While the second baby naglast ni siya about to 7 to 8 hours. So, there are three parts of first stage labor. So, first is early labor, second is active labor, and third is transition to second stage. So, first, let's discuss the early labor. So, what is early labor? So, early labor dilates about 4 centimeter. So, mag-open ang iyang cervix to 4 centimeters. So, contraction may go away, but over time, they'll get stronger. So, woman probably moving into active labor, mahibay animo if ang woman mag-move na into active labor if manotice na nimo ang changes on how frequent, how strong, or how long her contractions are. So, let's move into second, so the active labor. So, in active labor, cervix opens from 4 cm to 7 cm. So, unsa pa gani itong cervix opens? Dilation. So, mag-dilate siya from 4 cm to 7 cm. So, contraction every 3 to 4 minutes and each lasted about 60 seconds. Often means that the dilation is faster. So, ang dilation diri nga part sa active labor is pas-pas. So, about 1 centimeter per hour. So, as the labor progresses, the bags of water may break causing a gush of liquid. So, mubuto na tong bags of water. So, after that, the contraction is expected to speed up. So, relaxing during and between contraction saves energy and helps the cervix open. So, relaxing is kini nga part or diri nga kuan sa active labor is very important. So, helpful gajud ang mga butang like slow, easy breathing, focusing on positive, or like mga relaxing images and or musics, changing positions, kanang mga massage, or like kanang mga hot and cold compresses. So, third is transition to second stage. So, diri cervix opens from 7 cm to 10 cm. So, usually or mostly, pregnant woman or mother would say nga, kini nga part of labor is the most or the hardest or the painful. Kay, this is when kanang the cervix opens to its fullest. Like, mag-dilate na gud siya into fullest. So, contraction lasts about 60 seconds to 90 seconds and come every 2 to 3 minutes. So, the second stage of labor. So the baby moves through the birth canal. This is the part or the stage where kanang like i-push na ang baby sa birth canal. So it begins when the cervix is completely dilated. So completely dilated na siya. So 10 centimeters open. Ends with the birth of the baby. So contraction push the baby down the birth canal, and so the contraction continually strong, but they may spread cut a bit. So there is nga part kanang mulaong na ang birth attendant or mag-ask na ang birth attendant to pregnant patient nga i-push na push with each contraction means nga like kanang iiri na niya, iiri na sa patient, sa pregnant patient. So the second stage depends on the history of previous pregnancy, history of previous deliveries, the position, the size of the baby. So third stage of labor. So amo na ni ang like the afterbirth. So the uterus continues to contract to push the placenta, and then the delivery of placenta usually about 5 to 15 minutes after the delivery of the baby, so after birth. So next is the last stage of labor is fourth stage of labor. So the recovery. So baby is born and placenta is delivered. So here is kanang like most baby are ready to nurse within short period, pero napo iban nga like mag-wait a little longer. So ang strongly encourage ang mga mother to breastfeed her baby as soon as possible after the baby is born. So nursing right after birth will help the uterus contract and will decrease the amount of bleeding. So be monk. So this means basic emergency obstetric and newborn care. So this provide newborn screening services. So unsa mapud nang newborn screening or NBS. So it is simply as a procedure to find out if a newborn has congenital metabolic disorder that may lead to mental retardation or even death if left untreated. So kay mostly kanang mga babies nga naay metabolic disorders look normal at birth pero naa na di ay problem. By doing NBS or newborn screening, metabolic disorders may be detected. So importante jud nga naay newborn screening even before clinical signs and symptoms are present. As a result of this, treatment can be given early to prevent consequences of untreated conditions. The disorders tested for newborn screening. So the disorder tested for newborn screening are a congenital hypothyroidism, second congenital adrenal hyperplasia or CH. Next is galactosemia or GAL, and then D phenylketonuria PKU, and then E glucose 6 phosphate dehydrogenase deficiency, and F is maple syrup urine disease or MSUD. So A congenital hypothyroidism or CH. So unsa man ning congenital hypothyroidism? So CH is a condition of thyroid hormone deficiency present in birth. So if untreated for several months after birth or kanang ang severity niya may lead into growth failure and permanent intellectual disability. So the treatment is daily dose of thyroid hormone or thyroxine kanang ikuan sa mouth, by mouth. So next is congenital adrenal hyperplasia or CAH. So encompasses a group of autosomal recessive disorder. Each involves deficiency of an enzymes involving the synthesis of cortisol, aldosterone or both. Most common form of CAH is deficiency of 21 hydroxylase resulting from mutation or deletion of CYP21A. So disease can also result to death if left untreated. So next is galactosemia or gall. Occurs when an enzyme called galactose I phosphate uridyl transferase or GALT either missing or not working properly. So, the GALT enzyme job, ang iyang trabaho is to change galactose into glucose. So, when GALT missing or not working properly, then galactose cannot be changed to glucose, so it builds up in the blood in a large amount. So, unless treated, the excess galactose will affect many parts of the body and over time may be life-threatening. So, the next is phenylketonuria or PKU. So, an inborn error of metabolism involving impaired metabolism of phenylalanine, one of the amino acid, caused by absent or virtually absent phenylalanine hydroxylase or PAH enzyme activity. So, cautious gud ang mga like parents diri nga part kay protein-rich foods or sweetener aspartame can act as poison for people with phenylketonuria. So, phenylalanine is a necessary part of the human diet and is naturally present in all kinds of dietary protein. So, the rule of pH breakdown is phenylalanine from food. So not enough of PAH enzyme or cofactor, then phenylalanine can build up in the blood and the brain to toxic levels, affecting brain development and function. So for the next slide, Ms. Yanko will continue.
So, good day, sir. I am Riza Bianco, and I will going to continue the report of Miss Virai, the Chapter 7 Stages of Labor and the Cold Chain. So, now let's proceed to the glucose-6-phosphate dehydrogenase deficiency, or also known as FIVASEM. FIVASEM is a genetic disease involving the G6PD, an enzyme that is essential for the survival of red blood cells, and it primarily affects the male population. And the X-linked recessive genetic condition that predisposes to hemolysis. It is a genetic trait condition that can be passed down from parent to child through mutation, while hemolysis or the hemolytic anemia occurs when red blood cells are destroyed faster. A genetic disorder that affects red blood cells, it breaks down prematurely, and which carry oxygen from the lungs to the tissue throughout the body. There is no specific treatment other than avoiding triggers such as certain foods, illnesses, or medication. The glucose-6-phosphate dehydrogenase deficiency allele appear to be protected to some extent against malaria. Next is the maple syrup urine disease, or the MSUD, or also known as branch Pitacidoria. I don't know how to explain, pronounce. An autosomal recessive metabolic disorder affecting branched-chain amino acids. This condition, named from the distinctive sweet odor, affected infant's urine. So it affects the infant's urine among the amino acids. The infants with these diseases seem healing at birth but quickly deteriorate. So deteriorate means become progressively worse, often suffering severe damage or if wala ni siya proper prompt treatment, they will die from cerebral edema. Magkakos siya cerebral edema or the also known as the brain swelling. Brain swelling. The newborn screening is one of the strategies that can reduce infant mortality. So in the Philippines, the Department of Health introduced the Essential Interpartum and Newborn Care, or the AINC, as a strategy of ensuring higher survival rates of newborns and even improve maternal health, lessen risk of maternal death. So it also helped to um, it the essential interpartum newborn screenings has a big help in the newborn kay um, malesen ang danger sa baby in which help the rest of maternal deaths. The essential interpartum and newborn care also referred to the unang yakap or the first embrace. According to DOH, initial experience of the EINC scale-up implementation program in 11 hospitals has documented positive outcomes. O diba? In 11 hospitals, nakita nila the positive outcomes will saw nga the first embrace of the child pag makalugwa na ang baby sa mother, it helps to calm and scale up implementations against that. Next is the active management of third stage of labor. Although sample is inadequate to reflect effects on maternal mortality ratios, safe maternal practices have been adopted in all participating hospitals. Expanded program immunization, or the API, is to ensure that the infants or the children and mothers have access to routinely recommended the infant childhood vaccine. It is so important nga makatake sila og vaccines to avoid some viruses and rest of their health. And then the hepatitis B, potentially life-threatening liver infection caused by the hepatitis B. So it can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. So hepatitis B has been available since 1982. Vaccine is 95% effective. And it is a major health problem that hepatitis B can survive outside the body for at least 7 days. The virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of hepatitis B virus is 75 days on average, and the virus may detect within 30 to 60 days. In most highly endemic disease, hepatitis B most commonly spread from mother to child at birth. And that's what we call the perinatal transmission. So the development of chronic infection is very common in infants infected from their mothers or before the age of 5 years. Hepatitis B is also spread by percutaneous mucosal exposure to infected blood and various body fluids, as well as through saliva, vaginal, and seminal fluids. So sexual transmission of hepatitis B may occur particularly in unvaccinated men who have sex with men and heterosexual persons with multiple sex partners or contact with sex workers. So in essence, multiple sex is alarming. So if you have a partner, um, you must be mindful doing the rest because by doing some multiple sexual contact, it can cause viruses, especially if you don't know the person well, or in order to avoid, use protection in per I mean practical way. So infection in adulthood leads to chronic um, hepatitis in less than 5% of cases. So transmission of the virus may also occur through the reuse of needles and syringes either in healthcare settings or among persons who inject drugs. So in addition, um, infection can occur during medical, surgical, dental procedures, or even in tattooing, or through the use of razors and similar objects that are contaminated with infected blood. So, di ba, even in hospital settings, you can take that viruses because kayo wala ta kabaluan na nga person. So, we must sanitize, we must be alarming in our health because our health is very important to us. Even in a baby, for important reasons, dapat we have to sanitize and wash our hands if needed. Good. And then in this table, the rotavirus and pneumococcal vaccines are being considered as the antigen given below. So, um, newborn are highly susceptible to illness that they don't have much immune system of their own. The Centers for Disease Control and Prevention, or the CDC, provides a list of diseases that can be prevented with vaccines together with the help of the Department of Health. It established the Expanded Program of Immunization, or the EPI, to ensure that the infants and the mothers have access to routinely recommended the infant childhood vaccine. So there are 6 vaccine preventable disease were included in the API. So the tuberculosis, the poliomyelitis, diphtheria, tetanus, pertussis, and measles. This one of the best strategy to decrease infant from acquiring the communicable diseases, especially those which who are vaccine preventable. So I will start with the hepatitis B vaccine. Hepatitis B is given to the infant after born together with the BCG, or the Bacillus calmette guerin, right? After 6 weeks old or 1.5 months old, the infant will be immunized of DPT vaccine, or the diphtheria, pertussis, tetanus vaccine. This will be given in 3 times during the 2.5-month-old and 3.5-month-old. So the Bacillus calmette guerin route is intradermal or injected into the dermis. It protects against the TB, or the tuberculosis, meningitis, and other TB infection. And the diphtheria, pertussis, tetanus vaccine protects against 3 diseases, which is the diphtheria, whooping cough, pertussis, and tetanus. It injected into the intramuscular. through the muscle. And then, while the hepatitis B, it prevents being a carrier of hepatitis B, which can lead to liver cirrhosis or cancer. So, if you are wonder why there is half month in every vaccination, it is because to secure that the infant body is strong enough to accept the dose of vaccine. Next to DPT is the oral polio vaccine. In this case, the baby will no need to cry. It is because this vaccine will be given through the oral drop, and it protects against poliomyelitis. Then, and the last vaccine that the infant will acquire is to the alignment of the API is the measles. The infant will be given one dose. At the age of 9 months, uh, at the age of 9 months old, the route of measles must be subcutaneous or just under the skin or in the fatty tissue, and it protects against measles or viruses. So, um, being immunized or being vaccinated can save child's life because vaccination is very effective and puts child's life safe, and it protects to an infant's health. And so now I end this topic with the saying the parent-child connection is the most powerful mental intervention known to mankind. And that would I end my topic, sir. Thank you and have a good day. Bye, sir.
Hello, good day everyone. I am Rizal Visaya. Today we'll tackle about the cold chain. What is cold chain? Cold chain refers to the process used to maintain optimal conditions during the transport, storage, and handling of vaccines, starting the manufacture and ending with the administration of the vaccine to the client. Vaccines are sensitive biological products which may become less effective or even destroyed when exposed to temperatures outside the recommended range. In addition, information from manufacturers is not always available, so it can be difficult to assess the potency of a mishandled vaccine. There are three main types or main elements necessary to ensure proper vaccine transport, storage, and handling. First is trained personnel, second is transport and storage equipment, and lastly, efficient management procedures. Next is there are few true contraindications and precautions condition. There are two conditions are generally considered to be permanent. The first one is severe. Severe or anaphylactic is an allergic reaction to a vaccine component or following a prior dose of vaccines. Causes a series of symptoms including a rash, low pulse, and shock, which is known as anaphylactic shock. The second one is the encephalopathy. The encephalopathy, not due to another identifiable cause occurring within 7 days of pertussis, vaccination, damage, or disease that affects the brain. It happens when there's been a change in the way your brain works or a change in your body that affects your brain. The major symptoms of encephalopathy is an altered mental state. Its its general term for encephalopathy is brain damage, disease, or brain malfunction. Next is FIFO. FIFO or FEFO, which means First Expiry and First Out Vaccine System,
is a practice to assure that all vaccines are utilized before its expiry date. Proper arrangement of vaccines and labeling of expiry dates are done to identify those close to expiring. Vaccine temperature is monitored twice a day, early in the morning and in the afternoon. In all health facilities, has cold chain equipment for use in the storage vaccines, which included cold room, freezer, refrigerator, transport bags, and safety collector boxes. Next is international transport. Transportation with refrigerated trucks and for cold boxes are vaccine carriers for outreach. The first stage is procurement. The second is prepositioning. Third is transportation in country, and fourth and last mile distribution. As I was said earlier, the vaccines will start in the sourcing or the manufacturer, and it will end up into the administration of beneficiaries or administrations to the specific client. Next is the recommended temperature for national airport will be transit storage facilities. Temperatures will be 2 to 8 degrees Celsius. In the primary vaccine store, which is cold room, recommended temperature is 2 to 8 degrees Celsius, and freezer room will be negative 15 to negative 25 degrees Celsius. Intermediate vaccine store, which is refrigerators, the recommended temperatures will be 2 to 8 degrees Celsius, and a freezer room will be negative 15 to negative 25 degrees Celsius, same as primary vaccine store. Health center, refrigerators, temperature will be 2 to 8 degrees Celsius, and cold boxes. Health post, refrigerators will be 2 to 8 degrees Celsius, and cold boxes are vaccine centers. And that would be all. Thank you, and God bless.